Hello, I'm here to give you 3 medications. One is an intramuscular, one is IV, and one is probably going to be your insulin. But first, could you please confirm for me your name and date of birth? And he says, sure. So he confirms his name and date of birth. Good. How you doing today, Jonah? He says, well, I'm okay, except for the fact that I'm in the hospital, which is what most people say. I say, okay, again, I said, I'm going to give you 3 medications. My name is Catherine. Do you have any allergies? He says, no. Do you have any pain? He says, no. If he said yes, then we would give him the pain medication that was prescribed, wait 30 minutes, then we would come back and reassess him then to see how he's feeling. So I'm going to perform some hand hygiene. I'm going to put some gloves on. Oh, that's not a good glove. Put some gloves on. All right, Jonah, this is going to take about maybe 10-15 minutes. Not very long. Are you comfortable? He says, yes, I'm comfortable. I'm okay. Well, good. Okay, so first I'm going to look up your chart here and the provider order. Right here we have DocuCare, and I just want to see what your blood sugar is first. So I'm going to look up your blood sugar, see what it says. It says it's 250. Okay, so according to your dose, you're going to get 5 units of insulin. He says, okay. So we find our insulin needle, like this, insulin needle. We're going to give you 5 units of regular insulin. Regular insulin, right there. Regular insulin. Pop the cap off. Make sure that you have a alcohol pad so that we can scrub the top of the bottle. Make sure that I don't get any contamination or anything like that. So here I go. I'm scrubbing the top of the bottle with alcohol. And say, okay, Jonah, it's going to be a little cold here. Put alcohol on your stomach. So this is his stomach because you want to put insulin into the fatty tissue. So we have his stomach here. Now we have our insulin needle, which looks like that. Very small. We're going to give him 5 units. So we want to draw out 5 units of air, just like that. And we're gonna inject the air into the vial. We're gonna get 5 units of insulin. And you can either use a 45-degree angle or a 90-degree angle. So I'm gonna use a 90-degree angle. And say, okay, Jonah, you're gonna feel a little stick. Now, if Jonah is particularly lean, let's say that he doesn't have a lot of fat, then you might wanna pinch up. You don't have to if he has a lot of fat, but let's say that he doesn't have a lot of fat, so I'm gonna pinch it up, just like that. Say, okay. Okay, there you go. That's it. How you doing, Jonah? You okay? It's just a tiny little stick. Are you okay? So now we're gonna do the intramuscular injection. Are you doing okay? He says yes. So you confirm the order, which is for diphenhydramine hydrochloride. We're going to do 50 milligrams intramuscular injection. So you're going to find, I'm finding my needle here, just like this, and this is going to be a 1 to 2 inch needle. It's usually 1 to 1.5 unless the patient is obese, which Jonah is not obese. He might be even a little on the thin side, but he's going to get a 1 0.5-inch needle. So and we're going to find the diphenhydramine hydrochloride, and there it is, right there. We're going to find the alcohol swab once again, tear it open, scrub the top. I'm scrubbing the top so I don't get any contamination. My alcohol pad. Attach my needle. Okay, so I have a 1-inch needle. I'm going to, because he's getting 50 milligrams, we know that's going to be 50 units. Here we go, 50 units. So I'm going to put the proper amount of air. And then proper amount of diphenhydramine. There we go, just like that. We're going to make sure that there's no air in here. Okay, perfect. 50 milligrams, 50 units. So we want to go, because it's an intramuscular injection and it's a 1-inch needle, we're going to go 90 degrees because we want to get it straight into the muscle. So, okay, Johnny, you ready? You're just going to feel a little pinch. Inject. Okay, perfect. Perfect. And that also, it's important to mention that that was either in his delt, his arm, the top of his glute, or his thigh. And we're gonna take and recap this with one hand, just like that. Once we have it, we're gonna put it into our sharps container. Okay, that's in the sharps container. Okay, Jonah, we're almost done. I have one more medication to give you, and as I said, that is metoprolol. And we're confirming for the second time, it is 3 milligrams intravenous, so we're going to do it by IV push. So first, we're going to scrub the hub. Scrub this hub. You feeling okay? He says, yeah, I'm feeling okay. Okay. Scrub that hub. We're going to flush this line. Pushing it, we're flushing. We notice that it's not infiltrated, doesn't have any air bubbles. Okay, that's flushed. We're going to take our needle, open it here so that we can get the medication out. Once again, here we're at the bedside and we're confirming that it is 3 milligrams IV push. We're going to go ahead and check his heart rate. We're going to check his blood pressure, make sure everything is going well. Then we're going to take an alcohol pad. We're going to clean the top of his metoprolol here. Nice and good so we don't get any contamination. So 3 milligrams of metoprolol is going to be 3 mils according to the syringe. So we're going to drop 3 mils of air. Inject it into the vial, and then we can withdraw 3 mils of medication, just like that. All right. Okay, make sure that we don't have any air in here. Okay, take this and place it in the sharps container over here. And then once again, I'm just going to scrub the hub one more time. I want to be sure that it's nice and clean before we get started. Okay. Make sure there are no air bubbles. We're going to check for blood return, patency. That's good. Okay, Jonah, I'm going to give you the metoprolol now. If you feel lightheaded or anything like that, it's a side effect of the metoprolol, but we're going to inject this over 2 minutes. Okay, here we go. I'm looking at his heart rate just to make sure that everything is good. Vitals are good. I'm injecting this over 2 minutes, so it's nice and slow. Nice and slow. That's good. Okay, 2 minutes are up. We've injected all the medication. We are going to flush one more time. Make sure that we can maintain a good IV. Okay. And that's flushed. Okay. All right, John, is there anything else that I can do for you? Are you feeling okay? Good. Okay, I'm going to put these side rails up. I'm going to lower him to his comfort level and make sure that that his call light is within reach. And I'll be back to check on you.